Hi, Dr. Todd Sullivan from Nova Chiropractic Acupuncture. In today's video, I'm going to show you how to use a massage gun to relieve IT band syndrome. So the IT band runs from this part of the hip called the greater trochanter down to the lateral part of the knee. And what happens is this can get very tight and then it causes pain and discomfort right at the knee where it attaches. Sometimes you'll get pain right in the middle of the IT band or at the greater trochanter, but the most common is going to be down by the knee. To treat IT band syndrome, what we need to do is we need to loosen up that tissue up here so it takes the pressure off the knee. And one of the great treatments for that is to use a massage gun. To start off using the massage gun to treat IT band syndrome, what we're going to do is we're going to lay on our side, and what we want to do is we want to go up and down the IT band, finding any of these tight areas. And then once we find a tight area, we want to go up and down in that area for about 5 to 10 passes. And then we want to move on to the next area and go on that for about 5 to 10 passes. We want to avoid using the massage gun right on any bony structures like the greater trochanter or down by the knee. That could cause a lot of discomfort. So just focus on right above the knee and right below the greater trochanter. Okay, so what we're going to do is we're going to apply that massage gun, and you want to hold the massage gun at a 90-degree angle to the tissue. And for the IT band syndrome, I like to use either the round head or I like to use the flat head to do the treatment. It's a bigger surface area, and so you don't want to use one of the pinpoint ones because that could cause a lot of discomfort. So again, we're just going right into the belly of the muscle, finding any tight areas and working it back and forth. So once we work the belly of the muscle, then we want to work the area right between the quadriceps and the IT band. So this seam between the muscles is going to be a very important portion of the IT band to work. And now a lot of people with IT band syndrome, this is going to be very tight. So just be careful not to go too aggressive on this area. And again, you're going to find a lot of trigger points and knots right in this area, and this is going to be vital to help relieve the IT band syndrome. So again, just go up and down, finding any of those tender areas and focusing on them. Perfect. And then once we have that area treated, then we want to go to the back side. So between the IT band and the hamstring, we want to go along that seam and work it up and down. Again, be careful around the knee, it's going to be a little sensitive, and then go up and down that seam. A lot of people don't understand that the IT band makes up this portion here, but the quadriceps goes all the way up underneath the IT band and then all the way back to the back of the hamstring. So it's key that we work this whole section right here. The next area we want to treat on the IT band is going to be from the greater trochanter to the top of the hip. This area is called the TFL, or tensor fascia lata. And what we want to do is we want to work this area, again, avoiding the greater trochanter or the pelvic bone, and just go up and down. And this is going to be a much smaller area, so just be careful as you work this, but this is going to be tender too on most people. This is like an extension of that IT band going up in this direction. One way I like to use the massage gun to relieve IT band syndrome is to add in active motion while I'm using the massage gun. So once I've gone through and I've done it just statically without adding some motion, then what we'll do is we'll go back over the same areas but add in some active motion. So the first way we're going to treat the belly of the muscle is we're going to bring this leg in a stretch position. So she's going to straighten her leg and bring it back and down. So the motion you're going to do in this position is you're going to do like a leg lift. So she's going to raise it up and do abduction and then come back down. And what that's going to do is going to contract the IT band while we're doing it. So again, we're going to turn that on and we're going to go through that range of motion. Go ahead and do that range of motion. And again, just focus on the middle belly of the muscle here and just go back and forth like that. Adding active motion into the treatment helps to get the treatment a little bit deeper and also helps to warm up the muscle and loosen it up even faster. Now to treat the quadricep and the IT band, what we're going to do is she's going to go into hip flexion while we use the massage gun on that seam. Okay, so this is what it's going to look like. Again, we're going to find that seam right between the two, that lateral quad, and go ahead through that hip flexion. To work the IT band and the hamstring, what she's going to do is she's going to bring her heel towards her butt, and she's going to go back and forth like that motion while we treat that seam. So this is what it's going to look like. So I'm going to place it right on the seam and now go back and forth through that range of motion. Again, this may be a little bit more tender than the static position because we're activating the muscle, but this seems to help relax the muscle a little bit more. And so whenever I can, I like to add in the active motion. So that's how you use a massage gun on yourself to treat IT band syndrome. So if you have any questions, reach out to me at 703-912-7822, or you can schedule online at novachirowellness.com.